It filled hospitals and emptied the streets. It separated families and disrupted society on an unprecedented scale. When you face the extraordinary, you need to start with what you know. We knew a global pandemic of this scale was possible, if not inevitable. We knew that overstretched hospitals could be overwhelmed. And we knew that we had to be smart enough to anticipate unprecedented needs. That you cannot just pull a plan off the shelf to deal with a crisis like this. That when hypotheticals become realities, someone must be prepared to step up. And we knew from experience how to respond with certainty of execution when what if becomes now what.
Krucial Staffing was founded on the idea that we would develop the technology, the capacity, the bandwidth, and the people to deploy large volumes of staff, both clinical and non-clinical, into emergency situations. So we started planning last February of 2019, and we opened June 10th of this year. We were off to the races. When we opened our doors, within a few weeks, we had a border crisis. We staffed 2 hurricanes, and then another foster care project in Texas.
We partner with a lot of different entities throughout the United States. Some of them are government organizations, others are private partners, and they're calling upon us to help them get staff that they need to these crisis areas.
There are probably companies that do aspects of what we do, but we put it all into one piece. And I think that's what makes us so unique, is that we are the ones who are able to coordinate among different pieces and bring it all together.
In this room today, we are activating nurse practitioners and physician assistants for a large deployment that we have going on right now in New York City. So New York City, I would say, is the epicenter right now of the COVID-19 crisis, and their hospitals are understaffed and overrun with patients, so we are providing support staff at those hospitals to relieve their employees and help take care of their patients.
We were the first staffing agency to deploy to New York City at a time when it was the hotspot of not only the United States, but the world. So we started planning at the end of February of 2020, and we ended up deploying March 17th was our first day. So, you know, we came in full force. It took an army, we had little planning, but we were willing to take the plunge. So we were the primary provider for both the New York City Office of Emergency Management as well as the New York City Health and Hospital System. So we were really the only ones to come in and take that leap and jump right into the hospital system.
Our emergency operations center expanded from about 20 people to over 100 in 10 days to manage the crisis in New York City, as well as Louisiana. We're managing both of those projects concurrently. And the emergency staff is spread across different operations: logistics, HR, payroll, customer service, all different facets of the project that make it happen.
It is extremely fast-paced. So we have about 40 individuals that are taking phone calls today. But with that said, the lines are ringing busy. Some people can't even get through. We have hundreds of people that are calling us at a given time.
One thing that is unique to the emergency management life cycle is that, you know, you come in for the response. Well, now we're seeing that we are part of the recovery as well. You know, we've only been here for a month, and we've watched the tolls drop. We've been watching more beds open up because our staff is within the hospitals. So not only did we come here for the response, but we are planning to be here to see that life cycle through and through. We want to be here for the recovery. We want to be here when they're demobilizing staff because there's not a need for agency anymore. And that's something that's super special to our team and a driving force for the team.
We haven't had to do a ton of recruiting. Our staff have been recruiting for us. We do post frequently on our social media pages, especially Facebook and Instagram. Our followers on those 2 sites have quadrupled in the last 2 weeks. So we really just post and say, hey, call this number, phone lines are open, and the phones start ringing off the hook.
The team that has come together for New York City, it ranges from, you know, our physician assistants, nurse practitioners, nurses, RTs, CNAs, MAs. I mean, it's unmatched. We have a pool of personnel from across the nation that all came together to support a city that may not be their home state, you know? So it really shows the dedication and the passion that healthcare providers have.
And then the IMT staff, well, I mean, we all have our own backgrounds. So I mean, we're all just a melting pot of individuals, but we're all here for the same reason.
So the thing about Krucial that I've really appreciated, they are very informative. They reach out to us through text messages, through emails. So they have done things to tell us like, hey, we know you guys are working really hard. If you get sick, we have a nursing staff that's available to you. Told us like, hey, guys, if there's anything you need in regards to PPE, just reach out to us, and we're going to, manage that and take care of that for you guys. So they are always concerned about our concerns and our welfare.
From the heart of the country to the eye of the storm, Krucial healthcare professionals risk their lives to save others. These heroes on the front lines are driven by many things, but all share a sense of duty, and all are supported 24/7 by Krucial staffing. Because if healthcare workers aren't taken care of, the rest of the response collapses.
One of our Krucial crew corporate employees is a nurse as well, like me. I'm a registered nurse myself. And Krista has done an unbelievable job putting in an employee health program to keep everybody safe. Hypersanitation, daily temperature checks, daily fit for duty forms, trying to keep people spread out. So taking care of our people is just as important.
First conversation I had with them, they were just very upfront and made it very clear that the nurse was the priority as far as they're taking care of us if we're taking care of the patient. So they open lines for contact and Facebook messaging, texting. Then I even got personal contact from Brian himself, which is the CEO, and feeling like you can talk to the CEO is like, I don't know, you feel special.
I think it'd be safe to say there's not a single nurse here from anywhere in the country that had any idea what they were going to see. So the shock in the number of days they're working, the hours they're working, the distances they're traveled to and from work, all of that are kind of normal stressors, but what they're seeing, the amount of patients, the amount of death, those things just add. In the beginning we saw a huge, like a sense of futility. This disease, when it goes from barely noticeable in a person to bad, it's drastic.
One of the most unique things about the team in New York City is that they were the first people to respond to the COVID crisis. They came to the epicenter, they had no reservations about being there on the front lines to help. Every person that I've talked to, they want to see this through the end. They want to.
Krucial has a tremendous
hand with us.
So I just, from that moment on, I'm like, I'm sold.
And I feel very much protected and
around the world. Always with the conviction that when care is crucial, we are the ones that can be counted on to provide it. We don't see our
More than 60 women have come forward to accuse Weinstein of sexual harassment, assault, and rape.
By the mid-90s, we were aware of what he was alleged to be doing.
Weinstein has repeatedly denied allegations of non-consensual sex.
He believed that he was going to be untouchable.
The story of how Harvey Weinstein silenced his accusers.